Title: Nevada's Maverick Governor makes bold transgender health moves, while throwing a curveball. TLDR: Nevada's GOP Governor, Joe Lombardo, strays from his party lines by endorsing 2 bills bolstering transgender health rights, while throwing a wild pitch by vetoing a third. Despite facing heat from his party, he stands his ground, alluding to a more accepting future for transgender and gender non-conforming individuals, olive skin. But is there more to it? The political arena is never short of surprises, and Nevada's very own GOP governor, Joe Lombardo, just served up a juicy one. Bucking the trend of his fellow Republican governors across the nation, Lombardo has gone out on a limb, signing 2 transformative bills related to transgender rights. A brave move? Or a calculated strategy? We're here to unwrap the intrigue. While other Republicans appear to be endorsing anti-transgender policies, our Nevadan Maverick has chosen a different path. He's put his John Hancock on a bill that demands health insurance companies, including Medicaid, to cover all gender-affirming surgeries. This groundbreaking decision not only sets Nevada apart but also paves the way for a broader conversation about transgender health and rights. Another bill he sanctioned aims to raise the bar for mental and medical health standards for transgender and gender non-conforming people in state prisons, pushing for a more inclusive, sensitive and trained workforce. Kudos, Governor, for leading with empathy, olive skin. But here comes the curveball. Lombardo vetoed a third bill, which would have shielded providers of gender-affirming services from losing their medical license and prevented the executive branch from aiding in out-of-state prosecution. Why, though? According to Lombardo, the veto is to ensure that all gender-affirming care related to minors is in line with state law and maintains public health and safety standards. But critics, like transgender rights advocate Brooke Mailath, argue that the veto could worsen Nevada's already existing provider shortage. The vetoed bill controversy certainly adds a pinch of salt to the sweet progress. Despite party criticism, Lombardo holds firm, insisting that people should read the bill in its entirety to understand that it's not as draconian or detrimental or immoral as it's being portrayed. Let's not forget the bill's sponsor, Democratic Senator Melanie Schaibel, who frames the legislation as a money-saving tactic for the state due to potential lawsuit losses against state Medicaid. This move is seen to clarify ambiguities and give statutory strength to the cause, shifting the conversation from courtrooms to legislative halls. And still, there's the elephant in the room, the ongoing struggle to redefine many procedures currently classified as cosmetic to be recognized as medically necessary for treating gender dysphoria. With surgeries like hair transplants, facial feminization surgery, and voice modification often still labeled as cosmetic, the fight for comprehensive coverage continues. So, after all the moves, we're left wondering, is Governor Lombardo genuinely advocating for transgender rights? Or is he straddling the fence between societal acceptance and party alignment? Is his partial support enough, or does it